Good afternoon. I'm Serena Collado, Director of Community Health at Robert Wood Johnson University Hospital, Somerset. Welcome to our webinar on the Hispanic Medical Program, Meeting Needs of Our Diverse Community, presented in collaboration with Friends Health Connection. Hispanics are the largest racial ethnic group in the United States, and New Jersey has one of the country's largest Hispanic populations. Due to genetics, cultural traditions, and diet, Hispanics are at higher risk for some diseases than other groups, such as diabetes, heart disease, and certain cancer. During today's webinar, we will learn more about the unique health concerns facing the Hispanic community and how Robert Wood Johnson University Hospital Somerset's new Hispanic Medical Program is working to help promote early detection and prevention and increase access to medical care. We are pleased to be joined today by Manuel Nolasco Muñez, Hispanic Patient Navigator at Robert Wood Johnson University Hospital, Somerset. We will begin our webinar with about 20 minutes of a moderated discussion and then open it up to questions and answers from our audience. If you do have questions for Manny, please post them in the Q&A section of our webinar. So again, welcome, Manny. Thank you for joining us.
Good afternoon, everybody. How are you? How are you, Serena?
Good. Thanks again for joining. So first, why don't we start off, Manny? Can you maybe define for our audience what the definition of Hispanic is? Who's included in that?
Absolutely. So kind of a simple question, but it can kind of broad onto a little more. My definition of a Hispanic or someone who categorizes as Hispanic would be anyone from a descendant of a Hispanic family or, born in a Hispanic country. So we have Latin America, we have obviously overseas in Europe, Spain. Anybody under that category or from that family is, by my definition, Hispanic.
Okay. Thank you so much for that. So can you give us maybe an overview of some of the health issues that are most common in the Hispanic community?
Okay, absolutely. Based on research, I've seen that obesity, diabetes, and even hypertension are the most common health issues within our community. I mean, based on research and my everyday experience, the most common thing I see.
So then, why are these conditions more prevalent among our Hispanic community?
So I think the biggest problem is, while it's very delicious, it's our very high calorie cuisine that we tend to have within our community. So I think that's the primary reason, to be honest, for all of our common health issues. So
is the diet. So arroz, habichuela, like rice and beans.
You name it, yeah, everything.
Ensalada, empanada.
Every country has their own dishes, but they're all, they're delicious, but they're not the most healthy, thing we could put into our body. But it's just, culture, I guess.
So would you say the diet might be like high in sodium, high in fat content, calories, all that combined?
Yeah, everything.
No, but it is good. So
no one can argue that.
So what can our Hispanic community do to prevent these health problems?
So health education is probably the most direct solution that I can think of, just offering education to the community on, no one's telling you to stop making your delicious food, but there's moderation, I guess, a little more education on what kind of foods we might be able to include into those diets, just to kind of make it healthier for everybody, just to kind of prevent future diseases. For example, I know in Mexico, I don't know how well it's working. I haven't dug that deep into it, but certain snacks and products that they sell, on the corner of the bag, it'll say, excess in calories, so beware on this food. Like a lot of the snacks and stuff have that now. So I think that's part of their, as a country, initiative to kind of cut down on the high intake of calories and, sodium and fats and all those snacks. So that's another plan we might be able to do.
So, and to your point, making healthy options, like a healthy twist on a favorite Latin dish, right? Where I know I used to say, instead of frying platanos, can you maybe boil it? I know people are like, no, but that is an option to make it a little healthier, right? So,
Absolutely.
and then what do you think, what about exercise? Is exercise a barrier or a challenge for our Hispanic community? Because I know that usually helps play a role between diet and exercise, really preventing some of those chronic illnesses.
I believe it might be a barrier just due to time. That's the only thing that might get in the way. So, a lot of the Hispanic community I know are always, they're always working. They're always working, so it's difficult, between work and, if you have a family, and it's kind of, the time management is a little difficult to be able to, get in a workout and whatnot. Or, maybe some of the jobs are even, active enough to where they believe they're getting enough exercise, but maybe not. So I think that all plays a role in the health education. So both nutrition and exercise can be included in that.
Yeah, no, for sure. And I know in working with the community, I've always felt too, not only is it because people are working and working several jobs, but sometimes there's, childcare issues, and that makes exercise a barrier as well. So great points. I mean, something to think of in terms of how do we help the community break those barriers, right? So now, studies do show that members of our Hispanic community face several barriers to care, just like including language, lack of insurance, lack of access to preventative care. So tell us a little bit about your program. How does the Hispanic Medical Program help to address these barriers to care?
So the Hispanic Medical Program, from what I've seen so far, the majority has been breaking the language barrier. We offer translation services to our patients. That's one of the services, but that's the biggest one that I've dealt with so far. So we accompany patients into the room, into appointments. We help them translate. We fill out, paperwork if they need help with that. We help them direct consultations with the doctor, with the staff. It's just currently we have a language line. So we do have, an iPad where they bring it in and they'll translate, but it's not the same as having it in person, helping you, explain. Some people don't understand or might, maybe have difficulty hearing the actual device. So having it in person in the room is just more comfortable. And I've been told that it's more comfortable for them as a patient.
Great, thank you so much. So maybe you can also just maybe expound upon, can you explain what your role is as a Hispanic patient navigator?
My role varies per patient. Like I said, the majority of the time it is translation services, but I help them with whatever the patient needs. So while one patient might just need a little boost on translation, another patient might just need help out filling the paperwork. Some patients might have access questions, on some of the resources we have, or whether it's like financial difficulties, or trying to find a doctor to prevent certain diseases. Whatever the case, every patient is different, but it's very broad. They can call me with questions, whatever they need.
So, and I've seen, correct me if I'm wrong, if they need resources, either additional resources in the hospital or outside of the walls of the hospital, you also kind of help them with that, correct?
Yeah, so I'll push them, or I'll direct them to the right person, or need be, I'll take them to that person directly. Whatever, like I said, every case is different. So whatever resource they need help with is the one that I'll help them with. I'll direct them to or take them.
Yeah, and you've even gone to the extent of even assisting somebody in making appointments, because that could be sometimes, right, the whole system can be a little scary and difficult to navigate.
Yeah.
So, right.
A lot of phone calls, yeah.
So it's really, I guess, personalized, if you would say, kind of like personalized attention to help them navigate through the system, whatever their needs may be. Is that an accurate statement?
Pretty accurate. Okay. Everyone has direct personal access to the program.
Well, sounds good to me. So now, what are some of the programs that the hospital offers specifically for members of our Hispanic community? Can you maybe share that with the audience?
So obviously our new program, the Hispanic Medical Program, overall, that's one big resource for the Hispanic population, but we branch out into others. So we offer certain resources like Senos Sanos, It's a program we use, for breast cancer awareness and prevention. We have El Poder is diabetes education, and then we also have some of our BRGs like Salud. That's just a business resource group with some of the employees, but we also reach out to the Hispanic community, helping employees, patients, members of the community. But some of the good ones we have here.
Absolutely. And we do webinars, correct? Through community
Webinars.
We do webinars in Spanish for Hispanic community as well. I know Salud was instrumental during, the COVID-19 pandemic and going out and actually distributing masks, and supplies for our Hispanic community and actually educating in person. So that's a great resource group for us for sure. Very good. But we also have the, traditional care, like prenatal care, maternal child health, and things like that, that our Hispanic community, the diabetes center, that the Hispanic community can access. And there's also, interpreters, if not staff who speak Spanish, there is a language line for interpretation if you're not available per se, correct?
Yeah. If I'm not available,
yeah, because I know you're running a lot and helping a lot of people.
Yeah, it's a lot of people. So in the meantime, if I'm not available at that moment, they will use the language line, and then like I said, I'm a call away. I'll let you know if I'm busy at the moment. I'll always give you a time frame to kind of when I can reach you. So, but there's always going to be help.
Great. Well, thank you, and thank you for what you do. So now tell us about, I know we got into a little bit, but tell us about some of the health screenings and outreach activities you do to make members of our Hispanic community more aware of what they can do to take care of their health.
So in the time I've been here, we've done quite a few events and screenings. Particularly, I remember my first one, we did a prostate screening for the community. So it was no charge prostate screening. Anyone that could come, it's just getting awareness out there. But we do events. We've done like the Somerville Diversity Fair. We've actually gone downtown. People come out and just enjoy the music, the events, and all the businesses promoting. But we were out there just promoting our services to kind of make people aware of the the kind of events we hold in the future. Sometimes like the screenings in the future. We've been out to the supporting the town of Somerville in Ida relief. We work together with FEMA. We had an event out there. I met a few people out there. All the people I meet at these events, I connect with them. I get their info. I add them to my list just to kind of keep up with them, just keep them informed on any future events we might have. Also did an event with Middle Earth in downtown Boundbrook. So we were just, spreading the word on local businesses, getting the community involved in the shopping to all their local businesses. But I also connected with a lot of businesses in the community to kind of just keep them aware of our services, of our new program, and making sure they're up to date with any future screenings we might have or, clinics, whatever it might be.
Great, and thank you for all of that. I know Community Health partners directly with our Hispanic Medical Program. So when we have a community event, we really do outreach to our Hispanic community, and not only for the prostate cancer screen, but our stroke screenings, our skin cancer screenings, blood pressure, cholesterol, and even our flu clinics. So we appreciate your collaboration and support with all of those. Now, what do you say to members of our Hispanic community who are hesitant about coming to the hospital and seeing a doctor?
So the easiest thing I could say is to put your health first. Put your health in question. I'm here to make every step of the way as stress-free as possible. I know, no one likes going to the doctor, but if you have to go, you have to go to the doctor. You have to get checked out. I would like to ask the community to kind of put their trust in me. If you have any questions, you can call me. Even if you're thinking about coming here, just give me a call, and you're hesitant, please give me a call. I'll clarify anything you might need. But like I said, I'm trying to make this as stress-free as possible for you.
Okay. Well, thank you. Thank you so much, Manny. That's great to hear, and I'm sure that's very reassuring to many members of the community who, aren't familiar with, the hospital and the system. So So then for somebody who might not be familiar with the system, how do patients actually access the Hispanic Medical Program? And is there a fee? Is there a charge?
So the program is completely free of charge. It's open to anyone who needs the services. It's very direct access. It's a phone call away. All you have to do is call me. There's no, email, no wait list. You just call me directly. I have 2 phone numbers. So you can call me at my office at 908-927-8798, or you can call me directly to my work cell, which is 848-230-5002. So I'm typically here Monday through Friday. Hours vary. I can adjust my hours for the patient. If I don't answer you right away, welcome to leave me a message, shoot me a text. I'll get back to you as soon as I can. If it's something I can do right away, I'll do it. If I have to follow up on the next day, then, I'll let you know. But communication is key between myself and the patients. But like I said, I'm just a phone call away or a text.
And again, just to repeat, there's no fee, correct?
No charge. No charge.
For gratis, for free. Awesome. Okay.
Yeah.
So without naming any names, can you share an example of a recent patient who you helped through the Hispanic Medical Program?
A few weeks ago, I had a young patient come in, and she had never been to a hospital before, wasn't very familiar with the way our hospital ran. Fairly new to the country, so didn't speak much English, but she came in as a referral from another doctor's office to start basically her prenatal, treatment. I wouldn't call it treatment, but she's expecting a baby, so we're getting everything together, and luckily, the patient was able to connect to us, initiated, all the appointments with our family practice office. Thankfully, it's been a few weeks now, so patient has direct access to me, shoots me a text whenever, I'm, getting this done, or we're getting, coming in for an appointment, can you come help me? And, the patient can set up an appointment with me so I can accompany you to your appointment and just translate right off the bat. So we're a few weeks now, and patient is very excited because we're having, patient's going to have first child, and we're very excited about this. So patient actually told me, thankfully, we were able to have this program to make this easier, because I don't understand a word anybody's saying, and you just kind of making it a lot easier on me. So I was happy we could do that. Hopefully we could do that for a lot more patients.
That's great. And those are the little things that mean so much to people as well. So that's exciting. I'm sure for the family members, and very reassuring, because you're there to support them all the way. So thank you for doing that. Now, is there anything you would like to say? Maybe would you like to say a few things in Spanish directly to members of our Hispanic community who might be watching today's show?
Yeah, absolutely. So, make the switch. So, para toda la gente que está ahí en la comunidad, les aviso que pues cualquier cosa que ustedes necesitan sobre su salud médica, por favor denme una llamada con confianza. Todo lo que decimos aquí es protegido, es privado, todo. Deme una llamada, cualquier cosa que necesite, cualquier pregunta, si quiere venir, si tiene lo que sea que tenga que ver con el hospital, por favor, deme una llamada. Como ahí le dejé mi número de teléfono, se lo repito para que lo tengan. Más fácil, yo creo que con el celular. Entonces, hábleme al 848-230-5002. Déjeme un mensaje de texto, hábleme lo que sea. Cualquier pregunta que tenga, pues, con confianza, aquí estamos para ayudarle.
Well, thank you. And that was a lot, Manny. That was just a few things. And correct me if I'm wrong. You basically told everybody that, that if they need anything, to give you a call and it's in confidence, that they could reach out to you anytime they're coming here, whether it's a text or email, right? More or less. I'm abbreviating what you said.
I have we have in the chat from Miss Elena. Let me write down the number. That's a good point. I didn't know I had chat access, so I'll write it down now.
Yep, I can put it in for you, Manny, your number. Not a problem.
Okay, perfect. Awesome.
Yep, give me 1 second, and this will be to everyone. Okay, and again, your number in English was 908 927, oops, and then 8798.
That's the office number.
Okay, very good. So I'd actually like to give our audience an opportunity to ask you some questions as well. Again, if you do have questions for Manny, if you can put them in the question and answer section or even the chat, I'll pick that up as well. So let me see, we'll give our audience just a few moments. Since starting the Hispanic Medical Program, what can you tell our audience, what seems to be the biggest need? Like most people are saying they need help with X, Y, and Z.
The biggest need, well, 100% is the translation. Translation is the biggest one. Like I said, we do currently have a system in which the staff can just bring out an iPad and translate for the patient, but a lot of people tell me it doesn't work as well. They don't understand it. Some of our patients are hard of hearing, so it's a little difficult to use that. And it's not as personal, as having a person in your room directly translating everything told to you. Because sometimes there's side comments or, little concerns that aren't always being communicated, which has happened in some of the cases I've helped. They don't give them all the details because it's such a robotic, if you will, experience using the line. So they rather have a person in there to kind of just make everything easier. So that's 100% been the biggest need as of now.
That's good. Well, I mean, it's interesting to hear, right? But very understandable, knowing that communication barriers are one of the top reasons why people may not access healthcare, and it's very important. When we did our community health needs assessment, that's what our Hispanic community said, that they found it very difficult to access medical care, and they felt like there was no availability of language, both written and spoken, available to them. So
it's the biggest one. It's not the only one. There's a lot of barriers, but I'm just going off by my current experience that I've dealt with the program. But I mean, there's a lot of barriers to it.
Yeah. Oh no, for sure. No, but I was kind of curious to see what you have been seeing and what your experience is as you're working with various patients. So very good. All right. Well, I am not seeing any other questions in either the chat or the question and answer section. Do you want to leave? Is there anything before we depart would you like to share or say to the audience?
I think for now, pretty much anything. Like I said, any other questions, they have direct access. Anyone can call me, even if it's just questions about the program, and give me a call. But for the moment, I think I'm okay.
Okay. Well, very good.
Awesome.
And thank you so much, Manny. So if there are no other questions, and this is going to conclude today's webinar, we thank you all for joining us. Thank you, Manny. Please remember that the opinions expressed here today by our guests are not a substitute for medical advice from your own physician. If you need a physician, please call 1-888-724-7123. And for more information about our Hispanic Medical Program at Robert Wood Johnson University Hospital, Somerset, call Manny at 908-927-8798. Thank you all on behalf of Robert Wood Johnson University Hospital, Somerset. Thank you for joining us today and have a great afternoon. Take care, everyone.